session of the pharmacology discussions, and today's topic of discussion will be mainly focusing upon the HIV replication and the antiretrovirus drugs. So students, beginning with the HIV replication. So I have drawn the schematic flowchart as to how we can very easily understand the HIV replication, what after infection into the host cell, how the HIV infection and how the HIV replication is going to take place. So students, beginning with the HIV virus, as you all might be knowing that the HIV virus is a retrovirus and it is a single-stranded RNA virus. So students, beginning with the HIV virus is a single-stranded RNA virus, and the chief site, the target cells for the HIV virus is the CD4 plus cells and the T lymphocyte cells. So students, the HIV replication, the target cells, whenever a person is going to get infected by the HIV, the HIV's target site, target cells for its action is the CD4 cells and the T4 lymphocytes. And I would like to tell you, specify the receptors of the CD4 cells and the T4 lymphocytes. So the HIV virus gains access or entry into the host cell by exploiting the two receptors, the two most common receptors what are there on the T lymphocytes and the CD4 cells, and those receptors are the CCR, that is the CCR5, that is the chemokine receptor 5, and the CXCR4. So these are the two receptors what the HIV exploits, what the HIV virus is going to exploit to gain access and entry into the host cell. So students, since the HIV virus is a single-stranded RNA virus and it is going to have its target on the CD4 cells and the T lymphocytes. Now what is going to happen is, so on the template of the single-stranded RNA genome of the HIV, what is going to happen is a double-stranded DNA is being produced by the enzyme which is called as the viral reverse transcriptase enzyme. So students, on the template of the single-stranded RNA genome, a double-stranded DNA is being produced. A double-stranded DNA is being produced by the enzyme which is called as the viral reverse transcriptase enzyme, and this double-stranded DNA is going to get translocated into the nucleus of the host cell, where it combines with the chromosomal DNA of the host cell. It combines with the chromosomal DNA of the host cell to form the hybrid DNA. So the double-stranded DNA, what is being synthesized on the single-stranded viral RNA genome of the HIV, this double-stranded DNA is going to enter into the host cell. It translocates into the host cell nucleus, and there it combines with the chromosomal DNA, and there it is going to combine with the chromosomal DNA of the host cell to form the hybrid DNA, So what is going to happen is, and which then starts, and this hybrid DNA is going to start transcription, and ultimately this hybrid DNA is going to start its transcription and starts producing the viral genomic RNA as well as the viral mRNA. So students, this was the method of the HIV replication. So the HIV virus, it is a single-stranded RNA virus. On this template, a double-stranded DNA is being produced by the help of the enzyme which is called as the viral reverse transcriptase enzyme. This double-stranded DNA is getting translocated into the nucleus of the host cell, and the nucleus of the host cell, within the nucleus of the host cell, it combines with the host's chromosomal DNA of the host cell and forming the hybrid DNA. And this hybrid DNA is ultimately going to start transcribing, and this hybrid DNA is going to transcribe, and form the viral genomic RNA as well as the viral mRNA. Now, this viral mRNA is responsible for the synthesis of the structural and is responsible for the synthesis of the structural and the regulatory proteins are being produced. So this hybrid DNA is going to transcribe the viral genome, viral genomic RNA as well as the viral mRNA, and ultimately this viral mRNA is going to produce structural and the regulatory proteins of the HIV virus. So finally the HIV virus is going to get assembled, and finally the HIV virus is going to get assembled and gets matured, so and producing the billions the proteins what are produced by the viral mRNA, the structural and the regulatory proteins are being synthesized, and the viral genome, around the viral genome the core proteins and the enzymes are being produced, and the enzyme what is responsible here, it is the protease enzyme. So students, as you all know that the antiretrovirus drugs, these are the drugs which are helpful in treating the patients who have the acquired immune deficiency syndrome, that is the AIDS patient, and the AIDS related complex what is seen in the HIV patients. So these antiretrovirus drugs, they are classified depending on the steps as to where they are going to inhibit the HIV replication. So students, these antiretrovirus drugs, they are helpful in prolonging the life of the patient, and they are helpful in preventing the complications. They are helpful in postponing the complications what are seen in the patients of AIDS and the AIDS related complex. But these antiretrovirus drugs, they do not cure the infection. So students, this was a short discussion, the definition for the what is the role of the antiretrovirus drugs, and the classification of the antiretrovirus drugs can be classified into 5 broad categories what we can see. So the first class of the drugs what comes under the antiretrovirus drugs, it is the reverse transcriptase inhibitors. So the reverse transcriptase inhibitors are the drugs which were first and foremost, they were developed to fight with this infection. So under this category, the reverse transcriptase inhibitors, they can be broadly subdivided into 3 categories. That is the nucleoside reverse transcriptase inhibitors, the non-nucleoside reverse transcriptase inhibitors, and the nucleotide reverse transcriptase inhibitors. So beginning with the nucleoside reverse transcriptase inhibitors, under this category, the prototype drug, what is there? It is the zidovudine. So the zidovudine, formerly the zidovudine was known as the azidothiamidine, and this azidothiamidine, this was the prototype drug, that is it is the lead drug. It is the lead drug of this class. So this zidovudine, when it enters, it is going to elicit its mechanism of action. It enters into the host cell cytoplasm, and there it gets phosphorylated, and it gets phosphorylated to form the zidovudine triphosphate. So this zidovudine triphosphate is going to selectively inhibit the viral reverse transcriptase enzyme, and thus prevents the further spread of the HIV virus infections. So this zidovudine is mainly helpful in preventing the infection to the newer cells. So the newer cells, the HIV virus infection can it helps in preventing the infection of the HIV to the newer cells, but it has no role in preventing the step where the viral DNA has already integrated with the host DNA. It has no such role in preventing the infection to that cell where the viral DNA has already combined with the host cell DNA by the help of the enzyme integrase. So it has no such role. It is only helpful in preventing the new cells from getting infected from the HIV. Moving on to the next class of the drug, what is there under the nucleoside reverse transcriptase inhibitors? It is the didanosine, and this didanosine, it is again in the very same manner after entering into the cell cytoplasm. It is also going to get phosphorylated into the didanosine triphosphate, and this didanosine triphosphate is going to selectively inhibit the viral reverse transcriptase enzyme. So these are the nucleoside reverse transcriptase inhibitors. They are the chief and the distinguishing striking feature for them. It is that they are going to elicit their mechanism of action only after they get phosphorylated into the host cell cytoplasm, and then they are going to bind, and then they are going to inhibit the viral reverse transcriptase enzyme. So students, this was the discussion for the nucleoside reverse transcriptase inhibitors. And one thing more I would like to specify, that initially in the past, when there was only a single drug therapy was given, when only a single drug therapy was given for the HIV patients, in them, when only the zidovudine, that is the former name for zidovudine was azidothiamidine, and when azidothiamidine was given as a monotherapy in the past, when it was given, 50% of the patients developed resistance. 50% of the patients were there who developed resistance to such drugs, just because just because there occurred a point mutation. There occurs a point mutation which is going to completely alter the structure of the viral reverse transcriptase enzyme. Moving on to the second class of the drugs, what comes under the reverse transcriptase inhibitors, we are going to have the non-nucleoside reverse transcriptase inhibitors, and under this category we are going to have the three drugs, that is the nevirapine, the efavirenz, and the delavirdine. So students, the chief segregating or the distinguishing feature between the nucleoside reverse transcriptase inhibitors and the non-nucleoside reverse transcriptase inhibitors is that these are non-nucleoside related compounds, and there in them there is as such no need for these drugs to get the process to undergo through the process of the intracellular phosphorylation. These drugs are also going to inhibit the viral reverse transcriptase enzyme, but in them there is as such no need for the intracellular phosphorylation to occur. They are directly going to bind to the viral reverse transcriptase enzyme, obviously at a different locus, in contrast to the nucleoside reverse transcriptase inhibitors. So they are having a different locus of action where they inhibit the viral reverse transcriptase enzyme without the need for the cytoplasmic phosphorylation process. So the non-nucleoside reverse transcriptase inhibitors, I would like to specify a very important fact over here, that these non-nucleoside reverse transcriptase inhibitors, that is the nevirapine, the efavirenz, and the delavirdine, they are the drug of choice in the treatment in those patients who have HIV and they are pregnant too. So in the treatment of drug of choice for HIV treatment in pregnancy, it is the non-nucleoside reverse transcriptase inhibitors, and these non-nucleoside reverse transcriptase inhibitors, they are widely used in those pregnant patients, in those pregnant women who are having HIV. So I would like to specify one more point over here. If there is a cesarean section, if the baby is delivered by the cesarean section, and in that section if the mother is an HIV positive, then the chances of transmission to the fetus, it is to the newborn, is 40% in a cesarean section. All right, the next point, what is there, that if the pregnant lady who is having HIV and who is having HIV, and she is also undergoing through the cesarean section, and she is being administered the drug, that is the zidovudine. So cesarean section of the woman is going to take place and she is under the zidovudine therapy, then the chances for the risk of the HIV transmission lowers down to 27%. So originally, when the cesarean section was done to an HIV woman, the chances for transmission for the HIV to the newborn will be 40%. But when cesarean section is being conducted and the drug what is given to the HIV woman is zidovudine, then the chances for the HIV transmission to the newborn is going to get diminished. It is going to get lowered to 27% chances are there. And thirdly, when moving on, whenever this in the third case where the non-nucleoside reverse transcriptase inhibitors, that is the nevirapine, is given to the HIV positive woman and cesarean section is being carried out in her, then the chances of HIV transmission to the child is going to get further reduced to 13.5%. So students, this was about the non-nucleoside reverse transcriptase inhibitors. The third category of the reverse transcriptase inhibitors, that is the nucleotide reverse transcriptase inhibitors, and under this category we have a drug which is known as the tenofovir. This is not most commonly used. This is not used now, it is not used so commonly, so we can exclude this drug. Moving on to the fourth, that is the fourth class of the drug, which are known as the fusion inhibitors. So students, while the HIV replication is going to take place, the viral cell, the virus what is going to attack the CD4 cell membrane, firstly it is going to get fused, and there are drugs which have been designed to prevent the fusion of the virus to the host cell. So they are known by the name of the fusion inhibitors, and since they are inhibiting the entry of the HIV virus into the host cell, so they are known as the fusion inhibitors. And the drug what is most commonly used, it is the enfuvirtide. So these are the drugs, what the third class of the drugs. Moving on to the fifth class, that is the integrase inhibitors. So students, as I've already told you, that on the template of the single-stranded viral genome, a double-stranded DNA is being synthesized by the help of the enzyme viral reverse transcriptase, and this double-stranded DNA is going to translocate into the host cell nucleus, where it is going to combine with the chromosomal DNA of the host cell, and it is going to integrate. So the enzyme what is responsible for the integration of the viral double-stranded DNA to the chromosomal DNA of the host cell, the enzyme what is important for its integration, it is the integrase enzyme. So the next class of the drugs, the name, they have been named according to them, since they are inhibiting the integrase enzyme. So the integrase enzyme inhibitors, the drug what is there, it is the raltegravir. Moving on to the next class, that is the chemokine receptor 5. So students, as I've already told you, that the target cells for the HIV virus, it is the CD4 plus cells and the T lymphocyte cells, and there are receptors present on the CD4 cells and the T4 lymphocytes. These receptors, there are receptors, and these receptors, they are particularly the CCR5 and the CXCR4. There are these two receptors what are mostly exploited by the HIV virus to gain access and entry into the host cell. So there are drugs which have been designed to inhibit these receptors so that the HIV virus is unable to gain access or entry into the host cell. So these CCR5 receptor inhibitors, the drug what is there, it is the maraviroc. So maraviroc is that drug which is going to inhibit these CCR5, that is the chemokine receptor 5, and when this receptor is blocked, the HIV virus won't be able to penetrate into the host cell. Moving on to the last class of the drugs, that is the protease inhibitors. So students, as I've already told you, that the viral mRNA, after the hybrid DNA is formed into the host cell in nucleus, the hybrid DNA is formed into the host cell nucleus, and this hybrid DNA is going to start transcribing the viral genomic RNA and the viral mRNA. Now, this viral mRNA, it is going to produce the structural and the regulatory proteins, the core proteins for the viral genome. and the necessary enzymes. So the enzyme what comes into play, the enzyme what is responsible for this step, it is the protease enzyme, and this protease enzyme plays a chief role in the last stage of the HIV replication. So there are drugs what are going to inhibit this protease enzyme, which is responsible for the final packaging of the viral genome with the protein subunits. So these are the protease inhibitors, and these protease inhibitors, they are going to prevent the cleavage of the structural and the regulatory proteins what are going to surround the viral genome and transform it into a full mature virus particle. So these protease inhibitors, under this category we are going to have 3-4 drugs which are known as the ritonavir, the indinavir, the emprinavir, the nelfinavir and the lopinavir. So students, as you can see over here, these protease inhibitors, they are going to act in the last stage of the viral replication, and hence they are primarily effective in treating both the types of the cells who have been recently infected and the chronically infected cells with the HIV. So these protease inhibitors, they are helpful in preventing the HIV replication in both the newly infected cells as well as the chronically infected cells. So students, the these protease inhibitors, what are there? They are hence. And these protease inhibitors over here, protease inhibitors, the very important fact what is there for them, it is the phenomena of auto-induction. What is there in very important phenomena in pharmacology, that is the phenomena of auto-induction is seen in this protease inhibitors. And what is the auto-induction phenomena? Auto-induction is that phenomena where a drug is going to induce such enzymes which is going to enhance its own metabolism. So these are the protease inhibitors, and the phenomena for auto-induction is seen in these protease inhibitors. And one more thing I would like to specify, that since these protease inhibitors are going to act in the last stage of the viral replication, so they are helpful in preventing the infection to the newly infected HIV cells and the chronically infected cells, and as a result the structural and the regulatory proteins what are going to surround the viral genome and transform it into a full mature virus particle. So these protease inhibitors, they are going to prevent that step, and ultimately the virus particles what are being produced by after the use of these protease inhibitors will be immature, and non-infectious viral progeny will be produced. So students, this was a short discussion about the HIV replication and the antiretrovirus drugs what are used. So this was a short discussion about it. And students, if you do have any queries or comments, don't forget to comment me in the comment section. And if you like this video, give this video a thumbs up, and thank you for watching. If you haven't subscribed my channel yet, please go and do subscribe. Thank you for watching.